I passed my PLAB exam recently, and I just felt I should help other people who are currently preparing for that exam. When I wanted to start preparation for my own exam, the first thing I did was to come on YouTube to watch videos that would inform me about the exam so that I would know what I'm getting myself into and how to prepare for the exam. I actually find two videos that were quite helpful, but I just felt like there was something missing. It wasn't complete. So that's what I'm here to do today. I'm going to be sharing with you everything you need to succeed in your PLAB exam and pass at your first attempt. So you should watch this video to the end. Hello everyone, how have you been? Welcome again to my YouTube channel. If you are new here, you are very much welcome. My name is Damilola Oyetola and I'm a medical doctor. I film about faith, medicine and lifestyle, and like I've said earlier, in this video I'll be sharing with you how to pass your PLAB exam. So basically this video is going to give you a brief overview of the PLAB exam, what materials you need, how to study effectively, and what to expect on the exam day. So without wasting so much time, I'll just jump into the video. So let's just do a little throwback. So the PLAB exam so a little intro, brief overview. PLAB exam is what you need, the first phase of becoming a doctor in the United Kingdom. So if you are a doctor and you want to practice in the United Kingdom, PLAB is one of the exam you could choose to write. And of course, before you even start thinking of PLABing, you need to have passed your IELTS, which is a major obstacle for most people. Anyways, so after passing your IELTS, the next phase is PLAB exam. And you need to understand that the dates are released at certain times in a year. So it's better for you to open a GMC account so that they will be sending you mails about when dates will be released so that you will not miss it, because it's actually a tussle to find dates for the exam. It's quite competitive. Or follow them on Twitter so that you get info and you'll be prepared ahead of time for when dates will be released for booking for the exam. However, if you are someone that's studying in the Caribbean, then you do not need IELTS if you're writing PLAB 1 within 2 years of graduation. Now I'm making emphasis on Caribbean because that's where I studied. So the exam contains 180 multiple choice questions that you're supposed to answer in 3 hours. That means that you basically have 1 minute per question. So you see, time is actually not enough for you to go over your answers. So as you're answering your questions, you need to be sure that this is your answer, because for me, I couldn't review all my answers to the end before the time was up. So you need to learn to be time conscious for the exam. Also, the exam covers all the specialties in medicine, anything you can think of: OB-GYN, ethics, pediatrics, internal medicine, surgery, orthopedics, anything you can think of, even epidemiology, they are there. So it's actually a broad exam that is testing your knowledge of basic medical practice. I know that a lot of people are overwhelmed. I was overwhelmed too before I wrote my exam, but trust me, you don't need to be afraid. It's actually a simple exam if you follow the necessary tips that will help you to succeed in the exam. I believe that it's a simple exam. It's a simple exam compared to something like USMLE Step 1. PLAB 1 is relatively easier. So you don't need to be afraid, and you need to know that the first step to succeeding in everything is doing away with your fears, because if you are allowing yourself to be afraid, then you might not even be able to study hard because you'll be having anxiety, you're not able to sleep well and all. So do away with your fear. That's one of the first things that you need to know in preparing for that exam. The pass mark for the exam is like 60 to 62%, or generally based on how people perform. And you need to know that all questions carry equal marks and there is no negative marking like what they do in some schools in Nigeria. Another question you may be asking is, how long does it take to prepare for the exam? Well, I would say 4 to 12 weeks, and that's based on how busy you are. For people that are not working and you just basically have time to yourself to read every day, I was saying maybe 4 weeks is enough for you. But for people that are going to work, you have families to take care of, so let's say 12 weeks. So basically it's up to you. 4 to 12 weeks is enough to prepare for the exam. You don't need to take a year or 6 months, no, to prepare for that exam. The next big question is, what materials do you need for that exam? That's a question that most people actually ask. I'll say PLAB because that's what I use and it really works for me. Honestly, I don't think you need any other material apart from that, because it contains everything you need to pass that PLAB exam. So basically you just need to subscribe to the PLAB. I think they have 1 month subscription, 3 months and 5 months kind of. So you pay for the subscription. I can't remember how much it is, but if you download the app, you'll see how much costs based on the plan you want to subscribe to. Now PLAB is divided into gems, PLAB keys, then it has question banks and then mocks that would actually help you to study effectively. And if you can cover the whole of PLAB twice, I believe you'll be okay, honestly. I've also heard people talk about using the 1700 multiple choice questions, but that's not what I used, so I can't really say maybe that's what you need or not, but I didn't use that. The only thing I used to study for the exam is PLAB. Also, there's med revision too that some people swear by, but honestly I didn't use med revision. The PLAB I used was just sufficient for me, and by the time you start using so many resources, I feel like it's just going to be too much. Better to find what works for you and just focus on it. And the way the exam was, the kind of questions you find in PLAB, that's the way the questions in the exam are also structured. Do you understand? Other resources that you can use the NICE CK. You can just go to their website to check for certain guidelines. Also, you can use Oxford Handbook of Clinical Medicine, Oxford Handbook of Clinical Specialties to read certain things that are confusing. Now, when you're studying for PLAB 1, it's not the time to now go and bring out Harrison's Principle of Internal Medicine, blueprints for OB/GYN and studying. No, I honestly believe that you just be wasting your time. So it's not time to studying textbook afresh, because you don't even have time to do that. But I believe that your muscle memory would also help you. But then just use everything I've said, your PLAB, your NICE CK guidelines, and also the Oxford Handbooks to just further read on things that are confusing to you. Another question that people ask is, do you need an academy? And honestly, I'll tell you no. Save your coins. I paid for an academy when I started studying for my exam in initial weeks, and I just felt it was a waste of time, so I asked for a refund. So I feel like it's just going to be dragging you back, because everything you need is in PLAB and there's no need for a tutorial. And if you don't understand certain things, just go to your Oxford Handbooks, or better still, watch a video to better solidify the knowledge and clarify things for you. But I actually believe that going for an academy would be a waste of time or waste of money. But then whatever rocks your boat, whatever works for you, if you feel like you cannot study enough on your own and you need an academy, then you should go for it. How do you use all the resources I've listed effectively? Now, this is what I did. So the PLAB has different specialties where they write the PLAB keys of different specialties where you just read through. So there's OB/GYN, pediatrics, internal medicine, etc. So for instance, if I say I'm reading OB/GYN today, then after reading OB/GYN, I would make sure I answer all the OB/GYN questions, even if I can't finish it that day, maybe because I was busy in the hospital and I didn't have enough time to study. Then I'll continue answering the OB/GYN questions the next day. I did that for every system. If I read PITS today, I'll answer PITS questions. So I did that for everything. Then on weekends, especially weekends that I'm not on call, I try to answer one mock question. Now, the good thing about doing the mocks is it is timed. 180 questions, 3 hours, and it kind of helps you to simulate what is going to happen on the exam day, so you prepare yourself ahead of time, so that way you get to work on your timing too. So if you see that you're not able to answer the 180 questions before your 3 hours elapse, then you try to work on your time management more. Also, it's not just about reading and answering questions. So when you answer your questions, even if you got that question right, don't just skip and go to the next question like that. You need to review everything. So review your answers. So maybe you missed a question, so why was your answer wrong, and then why is this answer right, why was option B also not right? You get that kind of thing. So you review everything. And when you're answering your questions, please don't cram. It's not going to do you any good. You need to make sure that you understand what you are doing, because because you're not going to lift the questions from PLAB and then copy and paste for your exam day. It doesn't work that way. So answer the questions and endeavor to finish all your mocks before the exam. Like, finish everything. Even if, like I said, I did weekends, but at some point I felt like my doing it on weekends alone was not sufficient. So I started doing the mocks on weekdays too, and it actually really helped me. Now, for questions that you do not understand, don't just go over it and say maybe it should not come out. Try to read and read over again. Ask your friends that know better than you to help to clarify, and that way you're going to be good. You should also not skip your epidemiology, because trust me, epidemiology questions will come out. Even if they are not much, you'll still come. For me, I didn't read the epidemiology for my exam because I felt like I didn't have any brain space left to read epidemiology. So when I saw the questions in the exam, I was just picking any answer. But thank God I passed. Also, there are things like clinchers. Basically, they are like, once you see it in your question stem, then it helps you to be sure of your answer. Say in a question you saw elevated jugular venous pressure, muffled heart sound, and hypotension, then you know that the answer is going to be cardiac tamponade. Those things are Beck's triad. Also, if you see something like sandpaper rash, then it helps you to know your answers to scarlet fever. You get that kind of thing. So focus on the clinchers. They're actually in the PLAB keys. And it will help you to answer your questions on time. What to expect on the exam day? It's important you get to your venue on time. If you're writing an exam in somewhere like Lagos, Nigeria, where there's always traffic, don't do African time. Leave your house on time so that you get to your venue on time. So when you get to the venue, when you get to your exam venue, they actually tent where you sit down before it's not time to go and drop your bag in a specific space, and then they'll call you inside based on your seat number. You don't need to take valuables to the exam. First, you're not going to be allowed to wear a wristwatch into your exam center. Furthermore, you won't be able to carry your things inside. So if you have things that can easily be stolen, say your laptop, iPad, extra phones, I feel like you really don't need them. I know you'll be saying you want to revise on the exam money, but really you've been reading these past weeks and months, so what's there to revise anymore? But then they have a safe space where you can keep your things at the exam center. Furthermore, you need to go with your own pencil, your eraser, and if you want to go with water, ensure that you go with a transparent bottle. And if you are buying bottled water, just remove the label from the bottle and you're going to be just fine. So thank you for watching this video to the end. If you would like to see more videos like this, you should like this video so that I'll create more videos like this. Also, I'd like to see your comments in the comment section. And if you haven't subscribed, what are you waiting for? And of course, share this video with your friends that are also preparing for the same exam. Until next time, do stay safe and remain blessed.